Hi everyone, happy to be with you again. In today's session, we're going to talk about human health as One Health. For those of you who are familiar with Kigali, probably know this place. This is Kigali University Teaching Hospital, also known as CHK. And we are going to talk about One Health in clinical medicine for humans, how physicians and nurses can use One Health to comprehensively assess their patient, come up with proper diagnosis, and provide better advice or good advice for prevention. Our objective is to demonstrate the importance of training medical professionals in One Health and to show how diseases in human health and the degradation of the environment impact animal health. We look at the definition, sentinel diseases, food chain, impact of human behavior on the environment, clinical health history, look at the connection between health and the environment, and finally, see how clinicians can use system thinking in their daily practice, and then a take-home message. One Health is a collaborative, multi-sector and transdisciplinary approach, working at local, regional, national, and global level to achieve optimal health and well-being outcomes, recognizing the interconnection between people, animal, plants, and their shared environment. This is a One Health Commission definition for One Health approach, and it is emphasizing that One Health is an approach. It's not a discipline, and meaning that professionals from different disciplines have to work collaboratively on shared or common problem, wicked problem, cross-cutting problem affecting the three domain, human domain, animal domain, the environmental domain. It's multi-sectoral and transdisciplinary. One Health is not used by just clinicians in an hospital, but they're used by clinicians, veterinarians, and environmentalists on similar problems or common problems and find a comprehensive solution. This picture, you're looking at a girl with a dog, and 68% of US households own a pet. This is to show how animal and humans are close, starting from the household level. This is Ellen DeGeneres and her wife visiting mountain gorilla in Rwanda. This is showing how humans are still close to animals, even in tourism. Touristic activities most of the time involve people visiting animals in the park, especially during this time of COVID-19. You cannot go visit mountain gorilla without passing a COVID-19 test. This is to emphasize how we can infect animals and they can infect us. So it is in our interest to work together with professionals who are in charge with animal health to better find holistic solutions for cross-cutting diseases between animal and humans, also known as zoonotic diseases. And on the third image, we are looking at Dr. Barbara auscultating a lion which had a heart problem. If you got a chance to watch the TED Talk video that was shared with you in the pre-class reading, you've seen that she explained that after this assessment, she removed in the heart of this lion 700 cc of fluid. And she performed a very exact similar procedure like the one she performed in humans. Need to show how as humans and lions are very similar physiologically. And this is a slaughterhouse and slaughterhouse workers doing their job. This can serve as a sentinel place for brucellosis. Sentinel disease means that they can be an alarming sign for another species. If a slaughterhouse worker here is screened or is diagnosed with brucellosis, it can be an indication that there might be an outbreak of brucellosis in cattle of this neighborhood, of this place where he's working, or there might be an outbreak of cattle depending on where they get them from. So this can indicate that there is a problem in cattle, and this can alert veterinarians to screen cattle and treat them early and avoid a bigger outbreak. This is a case of lead poisoning, and lead poisoning affect both human and animals, and this can be a sentinel disease in animals, and it can be a sentinel disease in humans. If you see a child like this having all this sign, it can indicate that even a pet living in the same house with this child might have succumbed to lead poisoning, and it's the other way around. If you found it in an animal, it can indicate that even if the child is still asymptomatic, they might have also succumbed to this kind of poisoning, meaning that health professionals and veterinarians or people in charge of animal health need to work collaboratively on this kind of issues. They need to inform each other that this kind of problem is happening in this certain neighborhood, and it can help early diagnosis of lead poisoning or of brucellosis or of whatever disease is shared between animal and humans, and it can help prevent further damage. This graph is showing the food pipeline. It is showing all the processes that food passed through before reaching the final consumer. And it shows how it can reach the final stage having lost its quality. And a physician need to be aware of this while treating their patient. They need to understand that maybe that the food that the patient is eating is contaminated. We are looking here at the impact of human behavior on the environment. I gave the example of Amazon deforestation. It can be caused by human migration. There can be a need to create more roads for transportation, but it all results in other harmful effects to the environment, and it destroys the normal flora of animals, which can cause disturb the vector dynamics. It can cause biodiversity loss. It can cause climate change and extreme weather. And all of this result in a perfect storm of infectious diseases. 60% of existing human infectious disease are zoonotic. Zoonotic disease means that they spread between human and animals. And 75% of emerging disease are also zoonotic. Environmental health may affect human and animal health through contamination, pollution, and poor or changing condition. All of this is here to emphasize the importance of One Health approach in clinical health history. While a physician is taking the history of patient, they need to bear in mind what we just talked about. What is the exposure of the patient? What is your patient eating? What is or what are the activity they are involved in. So history taking is a critical step in the assessment of human patient, and missing animal contact history or environmental exposure may lead to false diagnosis. Specific chart that could be used in health facilities to collect information about animal contact exists. This is an example of how animal history can be taken while taking human history. It is found in a book of One Health in Clinical Medicine. We have it in our library. Those who are interested can read more about it. But this is an example of how a physician can ask history about animal contact. They can be like, these days we are discovering that several diseases may pass between people and pets or other animals. I'm going to ask you some routine question about pets in the house and any other animal contact that you may have, and whether your pets have had any health problem. This information could help me know whether there could be any connection between the health of animals that you live with and your health concerns. This condition is called neglected tropical diseases. It is a neglected tropical diseases called podoconiosis. It is a very neglected condition, and it is caused by just not by walking barefoot for a very long time. There is no vector involved in the acquisition of this condition. And this is to show how this cannot be a business of just health professionals. The mostly affected people are subsistence farmers. And it means that to be able to understand where this disease is coming from, or take good precaution, wear shoes, they need to understand that this disease does not have a biological vector. It's not a poison, it's not a curse, it's not a black magic like it can be believed most of the time in rural area. This is just caused by not wearing shoes and walking barefoot on volcanic soil rich in silica, and people develop this over a very long period of time. Can take more than 10 years to get this condition. But a good way of preventing this condition is to wear shoes, and that can only be achieved if health professionals and environmentalists work together to raise awareness in their community, to always remind subsistence farmers to wear shoes while doing their farming activities. And on this map, we are looking at the malaria incidence in 2018 in Rwanda, and the highest incidence, more than 400 people per 1,000 people, is close to places where there is rice cultivation. Rice is good to help malnutrition. It has been encouraged by the government to cultivate rice across the country, but also malaria increased with this rice cultivation. What we see here is that whatever people are doing can have side effect, and this is a reason why One Health is very important, a One Health approach. Here, farmers cultivating their rice and health professionals controlling malaria need to work together so that this kind of side effect don't occur, don't happen. As you might have already studied, the WHO failed to eliminate malaria using DDT. This WHO have attempted many times in the past to launch the global elimination malaria program using DDT, but it failed. But because DDT was also found to be harmful to the environment. So there is no magic bullet for malaria treatment, and malaria is a much bigger problem. Biosocial factors and the environment plays a big role in the control of malaria. And as we saw on the other map, rice plantation is associated with high endemicity of malaria. This was the case specifically for Rwanda. There are some gaps in the human medical field. Most human health professionals believe One Health concerns just genetic disease and global health, and it causes minimal engagement of them in One Health compared to veterinarians. There's lack of comparative evidence between human and animal medicine in physiology and pathology, which result in a lack of awareness of human health professionals as well as veterinarians regarding common conditions they both work with in their daily practice. Zubiquity Conference convened human health professionals and vets to discuss commonly seen disease in their respective patients since 2011. There's many opportunities in One Health, in research and education, in psychiatry, in oncology, doing comparative medicine. Human health professionals can learn from veterinarian how to treat anxiety, like we heard in the TED Talk video, or learn how to treat breast cancer from how they treat breast cancer in a tiger. And there are very ambitious projects that can help moving forward prevent future threats affecting animal, human, and the environment. This is a project on the global virome. It's an ambitious and virologic study of an estimated, ambitious genomic and virologic study of an estimated 70% of the world's 1.67 million viruses to learn which are likely to cross over to man. There's some criticism to this project, but it's a very important project that can reveal the connection between animals and humans, that can reveal viruses that has the ability to reach the man and cause probably threat. Like we've seen lately, COVID-19 has caused a lot of damage so far. It is believed to have originated in bats, and the intermediate host is believed to be a pangolin, and has caused a lot of damage so far. The annual cost of preventing future pandemic from wildlife are tiny compared with cost of the COVID-19 crisis. So where and how to conduct surveillance to prevent future pandemic? It's by focusing on One Health. Professionals in the human health domain, they want to focus on patient, epidemic, large prospective cohort, and animal health professionals and environmentalists want to focus on wildlife, ecology, intensive virology, and genetic studies. But the only way to go and achieve success or be able to prevent future pandemics is to understand the dynamic among the human, animal, and the environment, and it's by using One Health. This is to show how human, environment, and animals are connected on so many levels. They are connected at the level of the global society and biosphere and global fauna are connected, and they are connected until the molecular level. This is to show how understanding this interconnection can help achieve better outcome. This ROA is indicating planetary level interaction of climate on global population of humans and animals. And the ROD is indicating direct clinical relationship between Mr. Grover and his dog. This diagram was taken in the article that was shared with you, and you will have much time to reflect on it during the question for discussion that I will give you later on. But this is to show you how the three are connected on all levels. So how can clinician use critical thinking or system thinking in their daily practice? System thinking is the ability to holistically review and assess patient condition, understand the human, animal, and environment interaction, communicate with other professionals, know sentinel diseases and zoonotic diseases, know legally and ethically authorized activity in each domain, understand the food chain and food safety measure, and promote research in comparative and evolutionary medicine. Those are some of the examples, but there are many more things that can be done to holistically view a patient and apply One Health in clinical practice. So as take-home message, we need One Health to deal with complex emerging threat and comprehensively treat human patients. One Health goes beyond zoonotic disease and global health. There is a huge One Health research gap in human health domain, and existing evidences in the veterinary field that could be helpful to better understand certain conditions should be shared to human health professionals and vice versa. Thank you. These are the references that are used. You can read them, most of them well in the pre-reading first materials. So the question for discussion, I want you to read in the article, incorporate One Health into medical education, the clinical case example of Mr. Grover, and develop your own example of One Health case in human. Think about common cross-cutting disease, and don't worry about technical terms. You are encouraged to analyze each other's example and criticize whether they include a One Health approach or not. In your analysis, demonstrate the human, animal, and environmental component. I hope you enjoyed this session. Thank you.